Dental implants provide treatment option for replacing the missing teeth. The implant is drilled within the bone. Dental implants are made either from commercially pure titanium or titanium alloys. The titanium alloys that are used for dental implant manufacturing can be either titanium aluminum vanadium alloy or titanium zirconium alloy. Having dental implants placed within the bone is positively affecting the remodeling of the bone, which means once we have the dental implants placed and the crown made, the forces will be transferred through the crown and the implant to the bone, and this is gonna be critical for bone turnover. Almost anyone who are over 21 years old can have dental implant placement, dental implant treatment. Patients who have uncontrolled diabetes need a careful evaluation, a further careful evaluation. So if the blood sugar level is not under control, it might be a risk to have implants placed. The hemoglobin A1C level, which gives an information regarding the blood sugar level for last 3 months, needs to be considered. So if the level is below 6.5, we can comfortably place implants. On the other hand, osteoporosis patients who are taking biphosphonate medication would be a risk to have implants placed. Any surgery might be contraindicated for that patients. And as I mentioned, patients' growth needs to be completed in order to have implants placed. One other thing that has to be considered is heavy smokers. Patients who smoke over 10 cigarettes per day will be a risk for the long-term implant success. For the long-term success, osseointegration is a highly critical factor. Osseointegration is defined as the integration between the bone and the titanium. So in order to have a precise osseointegration, the loading time might vary. What do I mean from that? Well, we can place the implant and immediately load it by making a temporary crown. So we can make a restoration within 24 hours or even up to 48 hours. That's going to be immediate loading. And then we can either go with early loading or conventional loading or even delayed loading. So for a conventional loading protocol, for the lower jaw, we wait 2 months of a healing time. Contrary, for the upper jaw, we need to wait for 3 months. The bone structure, the bone quality is kind of softer in the maxilla because of the spongious nature of the upper jaw, and that's why we need to wait an extended period of time. Once we establish a good osseointegration between the bone and implant, then we can go ahead and have the restorations done. Implant supported restoration can either be removable or fixed. For the removable one, the retentive attachment can be either ball attachment, locator, or a bar. And these are dentures where the patient needs to remove the denture every night. On the other hand, we can have fixed prostheses which are placed by the dentist and cannot be removed by the patient. So the implant supported fixed dentures can be crowns where only one tooth is replaced, can be bridges where a multiple number of missing teeth is restored, or a hybrid or all-on-4, all-on-6 dentures where a completely edentulous case is restored. The long-term success of an implant-supported restoration is highly critical. In order to establish a long-term success of implant-supported restoration, the implant team needs to work precisely. So when I say the implant team, I am considering the surgeon, the restoring dentist, dental technician, and the patient. The surgeon, restoring dentist, needs to carefully plan and work and precisely work throughout the procedure, because we know that if you fail to plan, you plan to fail. But other than that, the patient himself is the highest contributor for the long-term success. which means the patient needs to carefully take care of his mouth, not only by brushing but also by flossing. Thank you.